Hi, this is Yvonne McNair, and I'm here with Donnie Gill, and we're at the Lincoln Trail Health District here, and he's going to give us some information this morning about some different things that are going on in our community health-wise. Now, we're going to start off this morning with Zika.
Okay.
First of all, tell us, what is Zika?
Zika is a virus, and it is spread by mosquitoes.
Okay.
And what it does to most adults, it doesn't really do much anything. You might be sick for a couple weeks, maybe headaches. I think your eyes swell a little bit, but your body fights it off. The danger is for pregnant women and women wanting to become pregnant. It can have pretty severe birth defects with the baby. The most noticeable one is a smaller head and smaller brain on the child. So then you have mental deficiencies to worry about after that. In addition to being spread by mosquitoes, it can be spread through sexual contact. So if let's say a guy gets bit by an infected mosquito, he could pass it on to his partners when they engage in sexual activities.
Okay.
We did start to see some cases in the U.S. last year for the first time, mostly in Florida. But we had a couple local contacts, but they had traveled abroad. I think some had been to Puerto Rico and gotten bit there and then came back. But each year it seems to be moving more northward.
Okay.
Um,
And what about in our area? Have we seen any Zika yet?
we had a couple cases, but again, they had traveled abroad and came back, and we were able to, efficiently and effectively, control that and make sure there wasn't a further outbreak.
Okay. Now, how do they determine, that where the mosquitoes are? How do they do that? What kind of testing do they do?
They go out and get samples in certain neighborhoods. I guess mosquitoes don't have a very big territory, so it can kind of localize in a mosquito population in a certain area. I think it was last summer they were looking at just a few square blocks in Miami, and that's where these mosquitoes that tested positive were all in this one neighborhood. But because we live in a society now that we travel a lot, we travel abroad a lot, plus you have shipping containers coming in, that's how a lot of invasive species get into this country anyways, through our shipping and our international trade.
Okay. So we look out for Zika. Is this Zika time of the year, in the spring?
Yes, anytime the mosquitoes are out and biting, it could potentially be Zika time, unfortunately. The ones that typically carry the Zika virus are the daytime biting mosquitoes. They're pretty aggressive, and so for mosquito prevention, we want to eliminate standing water as much as possible. If you have animals and you water them, let's make sure we change that water, because mosquitoes use water to lay their eggs, so we want to eliminate standing water.
Okay, so it's time for Zika and for everybody to watch out for that. What are some of the things you can watch out for? I know, like you said, standing water, and you have kids outside playing and mosquitoes during the day. What are some things you can look for in your kids to make sure that they aren't being bitten by these mosquitoes?
Well, I mean, we can use repellent. That helps. Make sure it has DEET in it. If it doesn't have DEET, it's not going to be as effective. Light colored clothing helps out as far as prevention. I saw a study where it said mosquitoes are attracted to darker colors.
Okay.
So if you're a person who wears a lot of black, you're probably going to be a mosquito magnet, which I am a little bit. So, and they also like stinky feet. So,
Okay. Those little rascals.
yeah, so it's just,
They like that odor.
yeah, they do like an odor.
Strong
and-
odors and strong colors.
Yeah.
Okay.
But yeah, just make sure you're using DEET and eliminate that standing water. I mean, it's almost impossible to prevent mosquito bites entirely. At some point, they're going to get you. But just keep an eye on just overall health during this time of year, because we have lots of diseases to worry about this time of year,
Okay.
in addition to mosquito diseases.
And with a normal, healthy person, they should be able to fight this off, right?
More than likely, yes.
Okay. So it's just something else for us to look for this summer.
Something else to be paranoid about.
Those Zikas. Another thing that has been in the news is E. coli.
Yes, there has been a nationwide recall on romaine lettuce. E. coli is, a foodborne illness. It's usually, for most people, it's a few days after you eat the contaminated product, in this case lettuce, and you're going to have possibly some pretty intense vomiting, diarrhea. A lot of times it's bloody diarrhea, stomach cramps, headaches, and typically for most people that lasts 3 to 4 days, and you make a full recovery. However, with other people in other cases, it can be a very, what's the word I'm looking for here? It can be an extreme illness, even jeopardize, somebody's life, and it can be deadly. So if you start to have bloody diarrhea or, something unusual after eating, go to the emergency room or go see your doctor and get that looked at.
Okay. Now they talk about the romaine lettuce, and they say it's out west. It's coming from the west. Is that correct? Because it's in season out that way?
I believe so, yes.
Okay. And it's just romaine and not your iceberg or any of your other ones?
I know
Lettuces.
some restaurants had pulled all lettuce because there was that warning issued at one point, but I think they have narrowed it down to the romaine, specifically the romaine at this point. So do check your fridges, make sure you don't have any old romaine lettuce sitting around, and if you do, let's get rid of it.
Okay. Does anybody have any idea how this happens with the lettuce?
It's usually, some kind of contamination takes place either in the growing of the lettuce or in the processing. A lot of the E. coli comes from feces.
Okay.
So if that contaminates the growing process or the preparation process, because with lettuce we don't cook it. There's no cooking step. And a lot of times when you cook something at the proper temperature, it kills anything that would be on there. But since there's no cooking stage for lettuce, it's a raw vegetable, we consume it, and that's how we get sick.
Okay. Now you say that contamination with feces. Are we talking human or are we talking animal feces here?
Either or,
Either or.
yeah.
Okay. So we have to watch that lettuce, that romaine lettuce.
Romaine lettuce. Throw it away if you have some.
Okay.
Better safe than sorry.
Okay, now will they give us the all clear when we can buy romaine lettuce again?
Probably. I think the Centers for Disease Control will probably put out a statement saying, hey, everything's all right now.
Okay, for the lettuce. Okay, so everybody be careful out there with that. A couple of weeks ago, we did talk a little bit about Hep A. So I was wondering if you could give us an update on that today.
Okay, yes. We are still seeing an upward trend in Hep A numbers in Kentucky. Most of the cases have been in Jefferson County. I think they've had over 300 cases just in Jefferson County. It started to come down into Hardin a little bit. We had 3 vaccination clinics, and we're trying to contain this, which is what public health does. One of our core functions is to stop the spread of disease. As far as Marion County numbers, you've had 2 cases down here. So it's not as widespread, definitely not as in Jefferson County nor as in Hardin County.
Now, can you tell me for Marion County, were these restaurant involved, or can you give us any information on those 2?
In our district, in our 6 counties, so LaRue, Hardin, Meade, Washington, Marion, Nelson, we have not had any food service workers test positive.
Okay.
So knock on wood, that will continue.
Okay, fantastic. Okay. Now, with Hep A, there's no season for it, is there? Is there a seasonal time that you can expect these breakouts?
No, you can get Hep A at any point of the year. I think this outbreak we're having right now is related to one that was in California. Again, we have a mobile population, and you're seeing it here now.
Okay. Now, once again, for our viewers out there, tell us a little bit more about Hep A so that we can be careful to avoid it?
Okay. Hepatitis A is a virus that affects your liver and liver function. It's transmitted through feces, so there'll be a microscopic amount of feces on something that you eat. Again, not enough to see, but it's enough to spread this virus because the virus is a really strong virus. You consume that food product, and then that's how hepatitis gets spread around primarily. It can also be on surfaces. You know, if somebody didn't wash their hands after they used the bathroom, then touched a desktop or a doorknob or something like that, it can live there for long periods of time as well.
Okay. And I know there is a vaccine.
Yes, there is a vaccine, and we are recommending that for Hardin County residents. But here in Marion, if you're concerned about it, go see your primary physician for it. It's a series of 2 shots. You'll get one, and then 6 months later you come back in for the second one. And you know, as far as I think we forgot to go over the symptoms a little bit again.
Okay.
The most noticeable symptoms of the onset of a hepatitis infection are a dark-colored urine or a Pepsi-colored urine, and in the stool will be kind of the color of a clay, so a grayish color.
Your grayish color. Okay. Okay. So we want to be careful with that. And as far as the shot that you're given for Hep A, can you tell us a little bit about that shot? I've heard some people have some questions about where it comes from and how
Okay.
it's put together and if it's safe.
It is safe. We've not heard of any reactions to the Hep A vaccine. It is made in North America. I think what we're getting is made in Canada. So it is fairly domestic, you know, with it being right next door. After the first shot, 95% of the people are covered and immune from that point forward, but they bring you in for that second shot just to make sure you're not in that 5% gap category. And the vaccine's been around for a while. It's very effective. You just got to make sure you get that second follow-up shot.
Okay. And you should be able to get that at your local drugstore or wherever you get your shots, health department?
Well, health department, what we are focusing on are underinsured and uninsured people. That's who our vaccination clinics have been for. We're targeting that population because they kind of fall through the cracks, and that might leave them more susceptible. So we're trying to fill in the gap for them a little bit.
Okay. But I should be able to get it locally.
Yes, just go to your care provider and inquire within.
Okay, fantastic. Okay, one last.
One last bit of good news.
Right, yes. Give us an update on the flu virus, because I know the flu ran rampant through here this winter.
Yes, last report I got, it's not widespread activity anymore. We might still see a couple pop-up cases, especially since we had that cold snap again. But numbers are trending down dramatically. So we can officially finally say we're out of flu season, but now we're into summer, insect-borne illness season. So if it's not one thing, it's something else.
Yes, it is. Can you give us some last words on the flu season, your perception of how it went, the flu season?
It got pretty hectic for us, trying to figure out all the contacts for people and try to contain it the best we can. A lot of flu prevention starts with yourself and washing your hands. Same with the hepatitis A. Same with a lot of the things that make us sick. Hand washing would take care of a lot of it. We're only asking for 30 seconds of your time, a little bit of warm water and soap, but you got to make sure you get between your fingers, the backs of your hands, and the nails, because germs like to hide in all those places. So, a little bit of hand washing goes a long way, and then, the flu shots, the flu vaccinations are effective. Even when they got it wrong like they did this year, that vaccine still lessens the length of the illness and lessens the intensity of the illness. So that's why, even though we knew the flu shot was wrong, we were still recommending that people get it, because it would, alleviate some of those symptoms.
Okay. And now with the information that they have from this year? Will they use that in order to put together the vaccine for next year?
Well, we'll see what goes on in the southern hemisphere
Okay.
in their winter, and they do these projection models, and it's always kind of a roll of the dice. So hopefully next year the CDC gets it right.
Okay, fantastic. Well, listen, thank you for talking to us. And if our viewers out there have questions or just want to get more information from you, how can they reach you, Donnie?
You could find Lincoln Trail District Health Department on Facebook. I run our Facebook page, or I'm part. It's a team effort, but I primarily do it. Or you can call me at 270-769-1601. Just ask for Donnie, and I'll be happy to answer any questions.
Okay, now the upcoming thing that we need to look at is Zika, right? The mosquitoes.
Yeah, we want to look at mosquito control as much as possible, and again, that kind of starts at home. And then also, what the Centers for Disease Control they're concerned about this year are tick-borne illnesses, and we're into spring and tick season again. Rocky Mountain spotted fever, Lyme disease, those are the two most prominent ones. Make sure you keep your grass cut low. Ticks like, longer grass and weeds. Wear light clothing so you can see if they get on you. And then just, if you've been outside working, doing yard work, just check yourself when you get in. A lot of times they like to hide behind the knees. They're tricky. They've evolved over the years.
Yes.
They're very good at what they do.
Yes.
But we want to make sure we keep an eye out on the ticks and try to prevent those illnesses as well.
Okay. Again, how can you be reached?
You can call me at 270-769-1601, ask for Donnie, or look for Lincoln Trail District Health Department on Facebook.
All right, well, listen, thank you so much for being with us today.
You're welcome. Thanks for having me.
Okay, the next time we see you, it'll be something new and
Hopefully
exciting.
some good news.
Some good news, for sure.
Yeah.
For sure. Well, thank you again.
All right, thank you.
Mhm.